At this point, we're not sure what we're going to do.
The usual bills will always cut into profits, but for Bill Bumgardner, who owns a Rogue Valley landscaping business and privately buys health insurance, the rise in insurance premiums has him trying to prune back expenses. But it may not be enough. Bumgardner says his rate is going up 35 to 40% in 2017.
We're going from about a $600 plan to about $1,100. Those are on a lower end plan as well. They're actually not as much coverage.
He doesn't qualify for tax credits.
I'm not sure what the government's thinking, how it's going to work out for everybody, because I don't know who can pay for it.
It's just not affordable for a lot of people if they don't qualify for a pretty healthy premium tax credit.
Ron Morris, an agent at Reinhold and O'Hara who helps people find health insurance, is fielding calls from clients. He tells me insurance companies say they're bleeding cash, and as a result,
rates have doubled and in some cases close to tripled in the last 3 to 4 years.
Morris says since the implementation of the Affordable Care Act, many companies have hemorrhaged.
Used to be that we had close to a dozen carriers that offered plans in this county, and now we're down to about 3 carriers that offer.
LifeWise Health Plan and Oregon Health CCO, a coordinated care organization, were unable to stay solvent and went packing. According to the Register Guard, in just months, MODA lost $33 million.
There are a lot of sick people that now have coverage and are using the plan, so that the carriers are forced to increase their rates based on the claims that they have to pay.
The cost of the actual care is also a big part of the problem.
There's, double-digit inflation on healthcare costs.
All of it putting a pinch on buyers' pockets. A Jackson County 21-year-old on Silver, MODA, Bridgespan, or Providence insurance will see their rates go up anywhere from 26 to 60%. A 60-year-old buying insurance through the marketplace can expect their individual plan premium to near $1,000.
But I'd say the individual plans as a whole are the plans that are taking the biggest rate increases.
Over 270,000 Oregonians do not have a group plan but purchase health insurance on their own. One local beautician tells me that the combined cost of her and her husband's health insurance in 2017 will be more than their mortgage. And it's not just individual plans seeing a price change. Ashlander Laurel May.
I used to just pay cash for my doctor visits. It cost me more to go to the doctor than it did before I have insurance.
Danny Lyles.
I'm literally working 2 jobs to pay for Lyme disease treatment, dental, vision, all that coverage.
Local companies wanting to offer employees health insurance, deciding between increased premiums versus reduced benefits.
Obviously, everyone's costs are going up.
And if more people pull out to face the ACA penalty, as 7% of the state's population already does,
and it really will lead to the whole system kind of almost imploding.
There is hope for those that qualify for a tax credit, which Morris says includes 85% of those buying privately. The U.S. Department of Health and Human Services says tax credits are tracking up at the same rate as premiums. According to the Kaiser Foundation, in big cities, out-of-pocket rates will virtually remain the same, despite the higher costs. The trouble may come in rural areas, like Southern Oregon, where Morris says there are fewer providers, allowing for higher rates. And ultimately, the money to fund those higher subsidies is passed on to the taxpayers.
I think our best shot for light at the end of the tunnel is for the Affordable Care Act to be repealed and kind of start over.
A House committee is demanding estimates on tax impact by November 7th. In the meantime, Bumgardner is hedging his bets.
The cost is still so high that it's kind of getting priced out. It's really hard right now because we're not sure how we're going to pay it.